thing. Believe you me, Kenyans will leave you alone. They will leave President Ruto. You will never hear anybody, Ruto must go. They will say the president is doing well. So my point is this. We are not, again, I repeat, my brother, we are not just against SHA. Fix it, clean it up, listen to what the Auditor General is saying, listen to what the Controller is saying, fix the hemorrhaging of our resources as a state. That is the bad behavior that we can't get rid of.
It is so difficult to disagree with Senator Onyonka on this one for two reasons. One, if you go to Rwanda, they had the same issue with us. Yes. Where education was all private.
Absolutely.
They turned,
yes,
and it became...
Kagame said, let everybody go to public schools.
Yeah, so that one I'm with you.
Yes.
The more reason I'm extremely passionate about SHA. There's an animal called FIF, Facility Improvement Fund.
Yes.
Facility Improvement Fund leaves money in the local hospital.
True.
And by the way, Senator Onyonka, I want to send you, there is something called facility, or there's a committee that's supposed to be at every facility level.
Yes.
Every governor is supposed to form a committee at every facility.
True.
They have not done that.
Did you see why what the governor said?
Yeah.
They are being forced to sign for equipment which they don't even need.
Let's put that aside, because the issue I'm saying is much more fundamental than that. I can come to the issue of school.
Okay.
Because that's a separate issue.
Yes.
I'm talking about money that is retained at the facility level.
That is true.
Yeah. So today, if you go to a hospital called Tabaka Hospital,
yes,
which is in your county,
yes,
there is supposed to be a committee.
True.
On that particular level.
That is true.
That is an oversight. There's a youth representative, a woman representative. You know, there's a whole oversight at that local level. That's supposed to say, because we are leaving some money in the facility to improve it. Why are we leaving money to improve that facility? So that we can rig the system in favor of the poor.
True.
Yeah, so that now this game is on the second half,
yes,
it is now rigged in favor of the poor. That's why I'm passionate about this thing. So this oversight at the local level is very important.
True.
What are most governors doing? They are not forming that committee. Number two, the account of the facilities are supposed to be having a local committee signing.
True.
Do you know who is signing those bank accounts? It is the governors, people, and the chief officers.
Thank you.
And do you know who's supposed to oversight them? Do you know who's supposed to make that work? Do you know who's supposed to tell them from this committee? Senate.
Do you know how many times we have got those governors he's talking about? I can run through with you.
We don't need the numbers.
I can give you.
But
wait. But
Senate has failed on that.
Jeff, no, Jeff, no.
The Senate has failed.
He is pronouncing propaganda. Right now, the Senate has audited books of all institutions and facilities of the government up to 2023.
No, I'm asking on a specific.
Wait, no, I'm coming there.
Right.
I'm coming there, Moses. I'm coming there.
Gentlemen, hold that thought. Hold the thought. We need to pay some bills. Take a break. Come back. I want to ask you, why are you so passionate about coming here to talk about SHA? You're not a CS. You're not a PS.
He's an
you're
advisor.
Not a DG.
You're Jews who helped by the Good Samaritan. Now, the Jew did not ask him, are you a Jew? You will not help me. I guess if it was in Kenya, they would be asking, what is your job grade for you to help me? Are you devolved? Are you national? So this, as I've said, is for all of us. You know, for me, I believe in teamwork. I believe in teamwork. And I believe in helping, by the way. Genuinely, I believe in helping. The other thing is that what we are doing today is unprecedented. It has never been done before. Previous governments have tried to do it. It is one thing asking CS Deborah, who is doing a fantastic job, PS Kimtai and PS Mudhoni, who are doing a fantastic job. But this is so huge. Jeff, today is Wednesday. The whole Monday, we had a meeting, I posted on my socials. We had an 8-hour meeting with the president, sitting down, asking questions. All of us, the president of the country, let alone me and a whole team of people. Today, the same thing, we've been held up. You've seen that decision to pay those NHIF was a result of a very huge, so more like, a university, lecture room conversations, push and pull, and because can you imagine this huge burden being left in the hands of one person or two persons? Even if I was a CS for health, I would not be able to handle this alone. So this is something that requires concerted efforts from everyone. That's reason number one. Number two, I've given you about my personal experience as a patient. And I really committed to that. That I don't want people tomorrow, and I want to agree with Senator Onyonka, that we should actually have a system that is run by public sector. He talked about, by the way, before I forget, about us public servants. Senator Onyonka, you are right.
Yes.
Do you know, every year, the scheme that you and I enjoy,
yes,
what is called the enhanced scheme,
yes,
runs at a loss of 1.5 billion
shillings
every year.
Yeah,
every
because we are the ones who want to go to India, we go to Dubai, we are going to Australia.
Not even out there, even here. When the child of a civil servant goes to Aga Khan for normal delivery, Aga Khan is paid was being paid by NHF 100,000 shillings for a cesarean for a normal delivery. The same delivery in Pumwani is 13,000. It's like you'd think the child of a civil servant is going to come from the womb carrying a trophy, because it is just wrong. It's immoral, and I believe that we need to look at that.
Absolutely,
you know that for me is not justifiable. That even those deaths that you're talking about, a very huge proportion is contributed by us,
public servants.
Sometimes, and I was Minister for Public Service.
Yes.
I say if you find a public servant in heaven, you're not in heaven. You are somewhere else. Because how can we? And that's the same thing I keep talking about. Sorry, because I want this system rigged in favor of Wajiko, in favor of the common person. How can it be, even for salaries? 1 million people, me and Onyonka, we are taking 46% of the tax collections of the country, leaving the other you guys to 53 million to scrabble for 50. That is a question of us. It's not here. I've said it again and again and again. I'll keep saying we need to have a civil service reform, and we need to have to inculcate a culture whereby we live like everybody else. Another reason that I'm very passionate about this is primary health care, for the reasons I've said. Even if I fail on level 4 hospitals, and I will not fail. Even if I fail on level 5 and level 6, let me ensure that 75% of Kenyans who are using level 2 and level 3, which might not be on Twitter, on TikTok, the tobacco hospital I'm talking about, I live for that. I live for that tobacco hospital, not for the big hospital up there. The other one is about the controls that this system puts in place. We used to have some hospital, and by the way, all the hospitals which were questionable, they used to have a Christian name. It is by a private guy, but it's called St. Peter's. Ukisikia St. Peter's, this is a faith-based hospital. It is not. The amount of fraud that was happening in NHIF, it is unimaginable to imagine how was it surviving. You find a claim being paid
19 times.
No, for 19 times. A claim being paid for maternity for a patient called Njoroge.
Yeah.
When did Njoroge give birth? A patient Njoroge.
Yeah.
Joint hip joint replacement, 19 times on the same patient. Do you know what the new system is doing? Churn it out. Njoroge does not give birth. You cannot amputate somebody. So if we just continue fixing those controls, we're going to save a lot of money. Finally, it is what I'm calling power to the people. What SHA is doing is giving power to the people. Today, if you go to the hospital, you can go to your phone and see all your medical history. You move from one county to another, whatever you are treated in that hospital follows you to the other hospital. Governor Abdulswamad of Mombasa, and I come there the whole of January in Mombasa, raised the membership registered to 54% with Governor Abdulswamad of Mombasa, digitized 92% of Mombasa facilities. As a result, Governor Abdulswamad can run Mombasa Health from his home, because he can see this doctor came for 1 hour, then went to another private hospital there, Pandia. Is being paid by this hospital has got medicine, is screaming. So it's all these controls. For me, I want to see the good.
Senator, you're going to get...
No, there is good.
Good, thank you.
You're going to get a chance.
The only problem is the good you're talking about. You see, you're talking about Mombasa. You didn't talk about Mukurweini. Wait. What we are saying, I know you're most probably making Mombasa the pilot, which is wonderful. Yes.
And then
to see it next, you move.
Next week, all over the country.
Yes. The only, for me, disclaimer I will give you, and I stick by what I'm saying because these are facts that we are handling. Please mention to the people in government, the public will believe you in what you're doing, Jeff, in fairness and in justice, when they know you mean well.
Absolutely. Good point.
We are now implementing a biometric system, so very soon we are going to move away from the OTP. I know the OTP is an issue, but the minute we move to biometrics, this will be a thing of the past.
Okay. Responsibilities are on Kenyatta, Moi Teaching Referral, Eldoret. You're talking about Kisi Referral, the hospital, Jaramogi, and the 146 billion. So if you gave 19 billion, you are joking. Proceed.
And for you, an ICU, now 4,000 per bed night. In next week, supplementary budget, when it passes in Parliament, it is jumping from 4,000 per bed night to 28,000. Because once we continue collecting more money, where else would we take the money except giving more benefit to Kenyans? So I want to tell Angote that Mambo Badu.
No, the thing that Angote is worried about is we don't know where the money is going. What I am saying, this thing, if you don't accept the challenges of this thing, then it means you are whitewashing it.
Would you tell Clementina to opt out?
Absolutely. It's not working.
Public officers cover, yeah, which to me is because something has to continue. But something I share with Senator Onyonka, that we cannot continue being like the animal farm where some animals are, and this is a burden. We are in concurrence.
Yes.
Civil servants, we have a case to answer. As regime. So somebody asked, how much should we pay? 300. Somebody else said, let's pay 700. And I think the readers of that time said 300 plus 700 divided by 2, 500. There was zero science about it. It was picky pompi. There was no science about it. Hey, no wonder it was unsustainable. Yeah.
Can I respond?
So, and the reason we're asking, you know, now me, I am paying 27,000 shillings from my contribution, from my salary.
Yeah.
I think Senator Onyonka is paying slightly more than me from his salary. Before, me and Onyonka, we were paying 1,700. My driver was paying 1,700. If you calculate the driver's salary contribution as a percentage of his salary, he was paying like 10 times more than what I was paying that time. My 27,000 is a lot for me. But am I complaining? No. Because I am saving the money I was contributing in other Harambes. And I'm sure that my 27,000 is treating somebody in Mandela, somebody I don't know. So it's just the same Harambe that we are contributing to. Only now it is one big Harambe. So it is okay. I hear what people are saying about being paid 1,300. But please consider civil servant who was paying, or not civil servant, payroll people. Somebody who was paying 1,700 has now to pay 30,000 for people that some of them he knows them, some people he doesn't know them. This is why I'm saying S in SHA is not for sugar, it's for social.
So can I respond?
One big Harambe.
Thank you,
How
Moses.
much are you paying, Senator?
The point is about 1,500, something
and
like
before?
that. Just hold on.
Before? As a matter of fact.
He's diverting my attention. That is what they were running for during the elections. The public was expected to pay 300. It's now 1,200. How many people today in Kenya can pay that amount of money?
Not many.
Thank you.
By then, Moses, how much do presidential advisors earn?
Well, they earn what is in their contract.
It's about 2 million. It's about 2 million.
So, for example,
It's about
we know
Oh,
Yes.
these guys are very well paid.
we know it's properly tabulated what members of parliament earn.
And you know, presidential advisors don't increase their salaries every day like senators.
No, but you deserve. Honestly, let me tell you, it will be very hard for me right now to defend President Ruto. You're doing well.
So,
So he deserves the
For
pay.
2 million shillings, it's not bad.
It's not bad, not bad.
That's not correct.
so how much do you earn?
But I like your press. And how much do you earn, Yusuf?
Well, I'm not a state
He's a
official.
HR guy.
He's not a state
I'm not a
officer.
state
He's not a state
You're not a
officer.
state official,
You are not a state. Yeah.
So let's do that for
My
now.
brother, thank you.
A lot of ambiguity. Bango.
No asking for comment.
So
Why
if
you closing over?
no, I'll respond. So I'll comment.
Yeah.
So if I don't have the out-of-pocket money, how would she have gotten out of the hospital?
No, wait a minute.
Yes.
Please read it.
So do you want us to get
Revert it, take it back and
it's
see.
in plain English.
Okay.
Yes. Everything she paid
So she
before
said, I
chemo
can't
was
complain.
from her
Please
pocket.
read between the lines.
Okay, let's read together. It's simple and plain English. Maria's used.
If you don't have that money, you wouldn't move.
No. Before
Chemo.
there was a comma there missing.
Yes.
Before
chemo.
everything was from the
No. Before chemo, comma.
No, there's
No, Moses. Don't teach us English here.
Next.
Boss, we went to university together with
I
you.
think she has no complaint.
I want this guy's number. And I will take it up with Fernandez Baraza personally,
The governor of...
governor of Kakamega, and do this thing. And I've seen even other people say that employed people should pay more than unemployed people. No, that's not true. We have got people who are in the informal sector, and I know many of them, who earn more money than people who are in salary. So being unemployed or being in the informal sector is not a measure of any means whatsoever. So this 1,030 is coming as a result of the means testing that's looking at different parameters. And by the way, my friend, you are lucky. I'm paying 27,000.
But can I?
You're paying 27,000.
Can I respond?
Yes,
A month.
per month.
That's because you're earning 2 million.
Absolutely.
No, I am earning less than
Absolutely.
a million. It's 2.75%.
Jeff.
2.75% is by the law.
Jeff.
So you don't even have to ask me about my salary.
Jeff.
Take a calculator.
I do the math.
Now
Yeah, do that.
Jeff, the police don't have this thing. The teachers don't have this thing.
But Wajiko
Yeah.
has.
Hold on.
Wajiko has.
Give me a minute. Surely. You know this bottom-up thing ended. Let's be reasonable. It's not about whether we are creating a country for Wanjiko or not. In fact, the people who are
How many teachers are there in Kisii County?
The people who
A county
are
of
just
1
hold
million
on.
people.
No, I don't
And
want
you
to
are
go.
concerned about
I don't want to go
teachers,
there.
few
No.
teachers.
You hear the attitude they have about teachers.
No.
That the teachers have. How many teachers are in Kisii?
No,
two teachers who are sick too many. Moses.
No, I agree with
what
you.
I'm saying. No, wait.
But
Allow me.
Let this focus,
Allow me.
Richard.
Let me focus
not
for you.
only be about teachers.
Okay, let me leave teachers.
Let's also make it a
Let me leave teachers.
A mwananchi conversation.
Let me leave teachers.
Do you mean
how
that
many
no more-
border riders can pay 1,300 shillings a month to get this health system work?
Let me say something.
Wait, when there are 3 children in secondary
Let
school,
him answer.
when they have,
Answer.
thank you.
Listen, how much was that border paying in terms of Harambe before? How much money were they paying for?
No, that is information. Why are we discussing Harambe? That is irrelevant.
No. It is very relevant because it's.
No, it is not. It is
Why do you
not.
want me to forget? It was only the other day we were doing Harambe for border people.
No,
We were
the border people don't want you to pay Harambe for them to be treated. They don't want Harambes to be treated. They want to pay it for themselves.
All right. More tweets coming in thick.
Next week, we are rolling out a more refined tool for means testing. As I said, we have received, not because of the accuracy, but because of the length of the question, and we have deployed various mechanisms and formulas and ways for us to be able to refine the means testing. Kenyans will see this means testing increase over time. As I've said, 5 months, 4 days. That is how long we have been with SHA.
All right.
Jeff, could I say something?
Just a
Stand by.
Thank you. Because we have many. Ask.
Now I'm repeating it here because I say it on another channel. But let me say about Baby Ariana. And first of all, condolences again for the loss of Baby Ariana. Baby Ariana was taken to India by the parents. Now, SHA gave something called GOP, guarantee of payment. By the time that guarantee of payment went to the hospital in India, the hospital in India said the parents have already settled the bill. So there's a lot of misinformation happening about this Baby Ariana. And Baby Ariana's mom knows very well because we had this conversation on NTV. And it's, first of all, to be treated abroad, there's no, among the 9,000 hospitals contracted by SHA, does not include even one hospital abroad. They are all hospitals here. To accept to pay for someone abroad is not an entitlement. It is actually a matter of very, very high discretion, yeah, which is very spare. In fact, it was very fortunate for this GOP to be issued. Nonetheless, our condolences for Baby Ariana's loss, and as I said on public media, and I repeat again, that we're going to start with this family.
And you'll take care of all the expenses and everything.
We are going to contribute as our hearts are going to be touched by that sad moment. And the government. And the president.
Jeff, I would like to say this. This is a matter that I wouldn't want anybody to politicize. It just shows you where we are. That even when Honorable Moses and team are working hard, and I believe him, I've worked with him before, I know he means what he's saying. These gaps are our problem. You see what I'm saying, Moses? These gaps are the ones which you need to get people, and I've said this before, who are substantive enough in the medical industry and accountants and lawyers sit down, because such a case was so pitiful, and yet it really wasn't even the government's issue. Because it was after the effect. We understand that.
Absolutely.
So I'm saying these are the gaps we need to cover.
Chebi from Eldama Ravine, Baringo County says, is it possible?
We are between a rock and hard place, damned if you do, damned if you don't. Because of the misuse of this approval system in the past, it is important for qualified medical personnel to go through surgery claims so that the system is not abused. At the same time, there is the issue of the urgency of the matter. So what our people are doing, we are now working to refine this, what we call the surgical decision making, the clinical decision making, to automate it as much as possible. Because I know right now there is a backlog and a delay happening there. I'm working with SHA. I'm pushing them every day to actually. Last week we doubled the number of doctors available on that, because someone has to look at the case, decide case by case. I wish it is something that can be digitized, but there's a limit of that, and again it's a working process. Again, that delay is informed by the abuse that we have seen in the past, which we don't want to see a repeat.
Okay. Alfie says it's so unfortunate that
and my response is very simple.
Okay.
I want to tell Moses Kuria, you have seen that, I think since this thing started, there are about 3 people who have said how the thing is working. If I give you the list on what I have my phone and everybody saying how it's useless and it's shocking and disappointing, I wish we would put them.
Okay.
And Onyonka, I want you to commit that now from tomorrow, yes, because I've told you, you will ask them to call 147 so that they get.
No, they are hearing you.
Yeah, 147.
They are hearing you.
Okay.
So because the next time you come here with Onyonka, we'll put, and by the way, that 147, that dashboard is going to be available for you guys in the media. So that anybody who is in charge is not working, put your ticket number.
Okay.
When did you report?
A lot to go through.
Thank you, and I'm happy. At least you see they are doing something.
Yeah.
Okay.
Please.
Thank you.
Okay.
So he listens.
KG.
If it was an Ireland void, if it was an illegality, we are a country of rules of law. Some have gone there, have been researched. The amount of fighting that people are fighting SHA from the stakeholders of the ODA, which I have told you has got 33 billion in debt, is shocking. One of the things, again, I'm passionate about SHA is limiting the administrative cost to 5%. Can you imagine the amount? We were taking all the money and spending almost all of it. Out of the money I've told you, the one which was actually going to the hospitals was only 1 billion. We are now spending around 4 billion plus to the hospitals. I'll give you an example.
4 billion, which category?
Yeah, the actual.
Thank you.
Now, I'll just give you an example. We have contracted 9,000 facilities in SHA. NHIF had contracted around 9,600. So there are some hospitals you have said that they are still in the old system. I think they are still checking. To make contracts for SHA, the one with this hospital, that hospital, we have used one legal staff by her name is Terry, who has gone through all these contracts, looking at it, and she's a very qualified lawyer, Toothcom. Do you know how much NHIF spent on just doing the contract? 1 billion. A law firm by the name of MMC, whose owner, Wakili Mureu, member for Gatanga, was here in your this morning. He was paid 1 billion for photocopying papers. Those kind of people who never support SHA.
Can I respond?
The amount of stakeholders I have seen that who are there, it is shocking. And we should look at even where to eat money. There are some things that will take you to hell.
Honorable Moses, that is what is called a red herring. The issues that are being raised are critical. Jeff, I've said some things here. You didn't answer any of them. Where is our data going? Who is the owner of the system? Which hospitals? We'll be interrogating those hospitals. We know some of his friends in government are the ones who opened those facilities. Why have they opened it? In fact, the reason why SHA has got challenges is because some of these guys who have opened their own hospitals are the ones who have actually made it possible, and they're the ones who are delaying because they want their health facilities to be included in the program.
And
hold on, Moses.
So what you're saying, there's a lot of stealing going on.
Oh,
let me say something.
Hold on, Moses.
It is a den of crooks.
There is no bigger den of crooks than what was happening in NHIF.
And they were in that government.
And I want to say
Jeff,
something.
he was in that government.
True.
Yes.
True.
They were in that government.
And there's a reason why SHA is here. SHA is not there in jest.
So when we raise
because of real
raise this, we say we respect that the president wants to change the system. But what we are complaining about, why are you doing it extrajudicially?
Senator.
Okay.
Moses, let's get some final thoughts going forward. Let's start with you.
This system is our system. Healthcare is very personal to everybody. There is no group treatment. treatment is personal. It's to you. For those Kenyans who want to believe in SHA, I've seen all the cases that SHA is. One day you ask yourself, why did I not join SHA? Why did I listen to that guy who has got some special cover, or he can afford private insurance? SHA did not come for rich people. SHA came because of that guy in Maralal who never had any, month of January, 400,000 patients went through the primary health care system. And each of them, people are talking about 900 shillings. The money we sent for primary health care was in the tune of 800 million shillings, meaning that for each people going to a level 2, level 3, we paid 2,000 shillings, for one, not the 900 that we are being told. That is in the month of February. SHA came to rig the system, to change the system in favor of the poor, who never had any hope. And for that, I wake up every morning thinking about SHA, not because of big people like me and you, but because of that person who has not 20 million people who are now can go to level 2, level 3, and be treated for absolutely free. The other people we can sort out later. Okay. But for the ones, for the 20 million poor people, I will go to heaven.
I would like to say this.
You get the final word.
Yes.
Senator.
I understand what my brother is saying. I wouldn't even want to contradict him. The only thing I would like to caution him is that as they are trying to change that system, which was broken deliberately and which has been part and parcel of the clique of the individuals who are stealing the money, which we all knew. What I would like to tell him is this: your friends have now moved from NHF, they have now come to SHA.
They have no chance.
Why, Jeff, why am I saying so?
They have no chance.
Let him come and tell us who owns that system, because that's the system that collects the money.
There is no chance.
Just hold on. I want to know how much money they have collected from last year. The Auditor General says, Kenyans, I don't know what is going on. My brother has really tried tonight to explain to Kenyans that, in fact, if the Auditor General says you have stolen money and whatever, that audit is not final. I have sat for the last 2.5 years in the CPAC committee, and I can tell my brother Moses, the management meeting happened, the first one. You are given the questions which you are going to answer, the issues and the contradictions. You are given 3 months to respond. If you don't respond, then she pronounces herself. What Honorable Duale is talking about, that the controller is politicizing this thing. Every time she's caught them with their hands in the till, they want her fired because she's too brave and she's talking the truth. Our systems, Jeff, are broken deliberately from IFMI system, from previously the NHIF. If you look at the university funding, you can run all financial systems in our government, whether it is county and national. All of them have been broken deliberately because money is being siphoned out.
Thank you.
And please, tomorrow when you go to Senate, feel free to call any government officer to ask questions, questions.